Hello everyone, happy Vascular Day. I am Dr. Rahul Agarwal, Consultant Vascular and Endovascular Surgeon, Care Hospitals, Gachibowli. So today we will be discussing about varicose veins. How does varicose veins occur? What could be the symptoms and what would be the treatment will be discussed here. So you know that veins, they take away the blood from the limbs or any part of the body back to the heart. Now you know in the limbs or in the legs, they are against the gravity, so that will not be so easy to take them back. So there are some mechanisms like the muscle pump mechanism. So when you walk, the muscles of the limbs work to push the blood up. Next, the heart pumping, that itself creates some negative suction pressure in the veins, and along with the breathing movement that is created. So that will push the blood up or actually pull the blood back to the heart. Now there is also something called as valves which are there in the veins, which will prevent the backflow or the falling of the blood when during the pumping action to go back into the limbs. So with these mechanism, the blood is taken from the limbs back to the heart. Now when does the varicose veins occurs is whenever one of these mechanisms fail. Most commonly either the valve is not there or the muscle pump is failing to function. Other uncommon reasons are sometimes there is obstruction or a complete blockage in the vein, which due to which the flow is hampered and the pressure in the legs, in the veins increases. Now these, as the pressure increases in the leg, there appears the symptoms of varicose veins, which are like pain when the patient is standing for a long time, which even appears during the day. As the day progresses, the pain appears, it increases. But he says when I lie down or when I lift my leg up, the pain is decreasing. So when you lift the leg up, the pressure in the veins is released. So that time the pain is also released. And the nighttime cramps in the legs is also due to varicose veins. So this is a common symptom. Now, as the disease this progresses in the varicose veins, there can be leading to the blackish pigmentation in the leg. The veins start appearing big, and sometimes even there is ulcer, which is there is tissue loss there because of varicose veins. So now how do you want to treat it? There are options of non-medical or we say non-surgical treatment or surgical treatment. Now non-surgical treatment involves use of compression stockings, which are actually not a permanent solution, but they can be used for lifelong. The compression stockings keeps the vein holding so that they don't release the pressure into the leg, and that works well. The patient has symptomatic relief. But stockings has to be worn regularly, there has to be changed regularly, and see that there is no damage to the underlying skin. The surgical option per se is involving the treatment into the vein, in which the abnormal flow in the vein is treated by occlusion of the vein by various methods. In this era of endovascular, we do it completely through a small pinhole where the laser ablates the vein through the endovascular thing, which is minimally invasive. So there will be no scar and there will be no significant post-op rest or any complications. In the follow-up, the patients has to just use the stockings for 1 or 2 months, and then they can discontinue it, so that the remaining small veins which has increased pressures are also decreased. So this video was to create some awareness about varicose veins in the general public. Thank you.